Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are speaking with Katie Boston-Leary, who's the Senior Vice President of Equity and Engagement at the American Nurses Association, about workforce challenges in nursing and how technology can play a role in addressing those challenges. So, hi, Katie, how are you?
I'm awesome. How are you?
I'm doing well. Thanks for coming back.
Oh, glad to be here. You're amazing at this, so of course I'll say yes to you.
Thank you. Thank you. Alrighty, well, let's jump right in. I know I'll see you at our workforce exchange coming up here in a couple weeks.
Mhm.
So, what are some of the biggest workforce challenges in nursing?
Yeah, it's you have the standard, and then you have some of the things that come to the surface based on what's happening in the environment. So, right now, the hottest issue is supply chain, right? With climate change and how that impacted our supply for IV solutions.
Mm-hmm.
Because our major manufacturing plant in the U.S. Was disrupted with Hurricane Helene. So that is one of the hottest issues right now for institutions because it's impacting care delivery. It's surgeries are being canceled at this point. Conservation efforts are in place, and there's a lot of bartering and beg, borrowing, and stealing of. So it's really taken a life of its own right now in a number of institutions, particularly and impacting, of course, nursing care, nursing leadership. But other than that, you have the standard things that are challenges. Staffing is one, of course, that is perennial. We know that we have a maldistribution of talent, and it's impacting how care is delivered, when it's delivered, where it's delivered. So that's a major issue still. You have workplace violence. There was this unfortunate story recently about two nurses that were hit by a car trying to care for a patient that was dropped off in the room entrance. And it was here in Philadelphia, where I am right now, attending a conference. You also have racism and discrimination, the DEI piece in that work that still has to continue, but it's been impacted by a lot of this major anti DEI push that's happening, particularly on the legislative side. So that's another major issue, right? Where it's impacting, how we show up as nurses, people who felt that we're making some inroads there, and now it seems like it's made it too easy for folks that don't want to do the work to not do the work. A dismantling of structures and programs, and some of leaders, because there was data that showed that because of that major shift after the murder of George Floyd, that caused this to become to be front and center. A number of people of color, leaders, were hired into these roles, and a lot of these department roles have gone away. So those are the biggies, and then you have some of the issues with incivility in nursing. You have this divide that's growing between nurses and nursing leadership about that are most important, and margin versus mission. And then you have AI, where people are not sure what to do with it, whether they should be scared of it or embrace it, or both. And yeah, it's all these pressures, the politics that are now taking a foot or hold in healthcare. So all these things, right, is impacting, which now amounts to pulls up to the major issue with well-being.
Hmm.
Well-being for nurses, well-being for leaders, well-being for systems that are supposed to take care of sick people. So these are all the issues that are on the table right now.
Absolutely. Yeah. It seems like, we were just speaking before the call. It seems like every day there's something new that comes up for CNOs and other nurse leaders, especially
Mhm.
with
Mhm.
nursing being such a large part of the workforce.
Yeah.
Um, so I wanted to ask you specifically about technology today. How does virtual nursing serve as a solution for some of these challenges?
Yeah, it's modality that has grown significantly over
Hmm.
the past year or two. Some organizations have jumped in it fully with both feet. Some are treading water and
Mhm.
probably just letting it come up to the waist. And
Mhm.
some are still on the fence because they want to see the outcomes with implementing this technology. And it's implemented in a number of different ways, and it shows up in a number of different ways. So, a nurse leader, a colleague of mine, said that it feels like the Wild Wild West.
Mhm.
So, how do we tame this beast? Which is why ANA decided to get in this space to establish principles around virtual nursing, how it should be done, and how it can be done right,
Mhm.
particularly with nurses at the table and designing these systems.
Absolutely. So what are those, standards and principles from the ANA about virtual nursing?
So you are trying to force my hand to share with you something that is not for prime time, but I will tell you this. We assembled, convened a group of subject matter experts from around the country.
Mhm.
And these are folks that are representative of various settings, inpatient, outpatient, ambulatory, industry, even looking at schools, like schools, not necessarily schools of nursing, but school nursing,
Mhm.
and correctional facilities and long term care, and even rural and underserved areas, particularly with Indian reservations and places like that. So we
Mhm.
hope at the end of this process, we'll have a product that will appeal to everyone in this
Mhm.
space that would help reset things so it's done the right way, for it to
Mhm.
be seen for what it is, which is it's additive. And the reason we say additive versus a replacement for is because we know there are many gaps, right, in terms of delivering care. We
Mhm.
know our patients are getting sicker, and the typical approach that we've had in some specialties to care for these patients is changing.
Mhm.
Someone told me the other day that Katie, is not your mother's med surg anymore. Med surg units are like
Mhm.
step down ICUs. There's also thinking around where behavioral health units would mostly be for the acute, and behavioral health will be in every specialty and department in an institution, right? We're supposed to
Mhm.
build acute care from the outside in versus inside out.
Mhm.
So we are trying to address the fact that it's additive. We're trying to address that the code of ethics should apply here. We're addressing the need for there to be security, right? With all that's happening with cybersecurity and ransoms that we just saw a report about an institution, Boston Children's, is now also their data is being hijacked to a certain degree. The
Mm.
competencies that are required for this to be able to work effectively and efficiently, informed consent with patients and families and legal guardians that needs to be in place as well,
Mhm.
from the patient's rights perspective. The nurse patient relationship, where it doesn't replace the fact that we still should remember that we are humans connecting with humans, right?
Mhm.
That's still going to be there while we also implement virtual nursing. And even in a remote sense, we should still figure out how to continue to connect with and build relationships with our patients. Um, the storage of information, right? So that is secure as well. We're covering all the legal piece, the portability aspect as well. A nurse in one state caring remotely for a patient in another state, what should that look like? We're also advocating for there to be reimbursement for virtual care as well, because that's another piece for the value of nursing, the
Mhm.
documentation requirements. So we're really trying to make sure we cover the whole gamut. The last piece that I'll share that we're working on is to make sure that cultural intelligence is also still applied with this technology, right? Where you still need to have humility, cultural humility, in knowing what your patient's needs are based on the relationship that you build with them. So our goal is to have this out to public comment in a limited way to other subject matter experts that are not on this panel. And
Mhm.
then once we get that feedback and incorporate it as where appropriate, we hope to publish early next year.
Awesome. Well, without revealing too much, obviously, what are some tips that you might have for CNOs and other nurse leaders to kind of pull from these guidelines to improve their own virtual nursing programs?
Yeah, I think the biggest one is not to compromise on standards of care, right? The same
Hmm.
standards that we hold dear for in person care delivery, same applies to virtual care. Hold the line because, from a financial perspective, you will have some financial leaders in institutions trying to force the hand to um, look at virtual nursing as a substitute for inpatient care.
Hmm.
And I do understand that type of thinking, but um, we still have a lot to learn. This is emerging technology for before we can even touch that, and that is not a place to start.
Hmm.
And third is if you have not looked into this, I think you are one of the late adopters. Like, this is something that really solves for a lot of the challenges and gaps that we have with patient care delivery. We know miscare is a
Hmm.
major issue. We know nurses most days, and I remember during my time as a nurse, I'll wake up and, maybe from sleep thinking about how, oh, I promised this patient I'll go circle back and talk to her or sit with her, and I didn't, right?
Hmm.
It helps with solving all these challenges that we have, where nurses have, continually said, there's so much that's being required of me in such a short period of time. So I do think that, that's the thinking, that's the approach, that's the mindset, that's the ideology behind this. And always, always, always measure outcomes. And when we measure our outcomes based on using this technology, tell it on the mountain. Make sure everybody knows about it, because a lot of people are waiting for this data. And I think that's how we get to data driven decisions in healthcare. We need to put the information out there so people would know and implement this technology and move the late adopters to the now.
Absolutely. Yeah. It's definitely one of those things where it's like get on the train before it leaves the station, you know?
Yeah, yeah. Now,
Yeah.
and I'll tell you this, I do worry about institutions that cannot afford this technology, right? Because it's not
Mm-hmm.
cheap. So I do think about rural communities where there's small community hospitals, critical access hospitals that are not part of large systems. So that's part of what we also want to get to and understand whether the various options, right, of virtual
Hmm.
nursing, um, um, based on resources that are available to institutions and institution leaders, that can help. Because
Absolutely.
there's a Cadillac version, right, that probably would not be affordable by most. But
Hmm.
what is, I'm not going to name the car because I don't want anyone to feel that I'm downing their car. But what's the American-made car version of this, right? That's a more available and accessible and affordable to organizations that don't have a lot of the resources that large institutions do. So those are
Hmm.
all the things we need to look at as well.
Absolutely. Well, thank you so much, Katie, for your time. I'm really grateful, as always, to have this opportunity to hear your insights. And thank you so much to our audience for listening.
Thank you. Appreciate it.